Hi, good evening, everybody. Tonight I wanted to talk about a very common topic, and here it is, PCOS. Now, what does this stand for? Basically, it stands for Polycystic Ovarian Syndrome. This is becoming increasingly common in our patient population these days, as essentially it has to do with a woman's inability to bear children, becoming very infertile. Oftentimes they get weight gain and other things as a result of the hormones that go off with this. So this syndrome, the PCOS, it affects about 5% of women in the United States right now. It's a disorder that starts usually in about puberty. And the most common symptoms are, there we go, looking at my handy tool here, ta-da! The most common symptoms, obesity or weight gain, hirsutism. Now there's a fancy word for it, but basically what that means is hair growth in areas where the women usually do not want hair growth. Usually it is in male pattern areas like around the chin area, sometimes around the breasts or the other areas that are normally associated with more male pattern of hair growth. So when that happens to a woman, we call it hirsutism. So also, sometimes the hirsutism or male pattern hair growth is so exasperated that the women actually have to sometimes shave in the morning as the same way that men do. So moving down the list, obesity, the hirsutism, decreased periods. The periods actually can be very few and far between sometimes, and they're usually very irregular. And as I mentioned in the very beginning, PCOS is one of the most common reasons why women these days are becoming infertile. Another very common reason for infertility, and one that we screen often for, is actually chlamydia infection. And for the young ladies in the clinic, it's something that the government regulatory bodies recommend that we screen all young women up through age 24 once a year with a simple urine test to check for chlamydia gonorrhea, because if the chlamydia is present but not taken care of, it can scar down those ovaries. So PCOS is a very common cause of infertility, and chlamydia infection, left untreated especially, is the second. All right, so back to our list. Obesity, hair growth, lower periods, or fewer periods. Ovarian cysts. This is something that sometimes can be a little bit difficult to identify. The most common way that we identify these cysts is through a ovary ultrasound or a pelvic ultrasound. So the thing that's a drawback to the ultrasound is you have to have a radiographer and a ultrasound technician who are very experienced in looking for these cysts, because sometimes they can be very obvious and sometimes they can be a little bit more subtle. And so for that, one of those reasons, we do not necessarily make the diagnosis based on the ultrasound alone, but usually more on the symptoms and sometimes the profile of the hormones that are checked. More things that tend to go along with the PCOS. Acne is very common. And finally, male pattern hair loss. Now, you might be wondering, why would women be getting all of these symptoms? And one of the main things that a lot of these symptoms are a result of is hormone imbalances. In other words, they tend to have more androgens. There's another fancy word, but basically what that means is testosterone and also similar testosterone-like components are coming out into the bloodstream. Now, there are a few risk factors for women that are a little bit more likely to get PCOS rather than not get the PCOS. And one of them is weight gain or obesity itself. Women who are obese in the first place are a little bit higher risk. However, that might be a little bit of a which came first kind of scenario. Was it that they had the weight gain and then they developed the PCOS? Or, and I think that this is probably a little bit more likely, they have the hormone dysregulation and then the weight gain happens. one of the other main hormones that gets out of whack with this syndrome is not just having the ovaries and the glands produce more testosterone than usual, but also tends to be much, much higher insulin levels than usual as well. And as you might have known from our diabetes lecture a few weeks ago, when people have high levels of insulin, it tends to cause the metabolism to cause the body to cling to the calories. And so if the insulin levels are high, there's a much greater chance or much easier chance for people to become more obese merely partly because of that. Now, of course, this is not universal. There are folks who are thin that have the PCOS. It just happens to be much more common in the women who are overweight, or more common in the obese ladies. Another risk factor for developing PCOS is having epilepsy, which unfortunately affects about 1% of the population. So epilepsy is way more common than you might think. Some of the anti-seizure meds also seem to mess up the metabolism and put people at higher risk. Finally, family history of PCOS is another common factor. So about 40% of women with the PCOS actually have a first-degree relative. That means mother, father, brother, sister, who also have the condition. Obviously, in this case, I mentioned brothers and sisters, but the brothers and the fathers, if they have PCOS, then we're going to have another conversation in the clinic, because obviously men would not get this because most men do not have ovaries as well. So some of the things that you can do proactively for treatment of PCOS. So we've covered the condition and some of the risk factors and some of the symptoms that go along with it. Now there's a few different varieties of treatments. So if you go to the usual doctors who take care of PCOS, that could be your primary care physician, internal medicine, endocrinology sometimes, or gynecology. Those would be the four most common people that would treat PCOS. It is something that a family practice physician often can treat as well. There's some medications. Sometimes we'll go for something like metformin, sometimes birth control medications, and then there are other medications that specifically target some of these hormones as well. And there's a lot of options that are out there. And it seems as though medicine kind of swings back and forth. You know, some years metformin was actually discouraged or out of favor, and other years the birth control was discouraged, and now they seem to have gone back to recommending one or more of those. And sometimes there are some other medications, such as spironolactone, that will fight some of those beard growth and other things. Of course, the medications do have some side effects, and as always, if you have any questions on any of that aspect, please always see your own personal care, primary care physician as well. So what else can we do to help with both the symptoms as well as the side effects of the PCOS? Most of the symptoms can actually be managed very well through diet and lifestyle changes. So a low-fat, whole food, plant-based diet can be very, very helpful for this as well. And part of the reason is because it is very, very good at helping to reduce the excess hormones, as well as being very good at helping to regulate some of the side effects of the high insulin as well. So it reduces the risk for diabetes, which is very, very, very common in people with PCOS. It also improves the insulin resistance and takes some of the workload off of the pancreas. So again, referencing back to the diabetes video a few weeks ago, if you haven't seen the pre-diabetes diabetes video, please check it out. But basically, when people have resistance to the insulin in their bodies already, then after a while, when the pancreas is pumping out lots and lots and lots of this insulin, after a while the pancreas can start to kind of peter out. It basically isn't able to keep up that high demand for a very long time. So eventually that's when you start to move into the diabetes realm. And so by having a whole food, plant-based, low-fat or no-fat diet, I should say no added oils diet, because even this dietary pattern that I talk about does contain some nuts and seeds and other dietary sources of fat in the foods. Basically, you're helping to improve the insulin levels and the ability of the body to handle the food that comes in. Also, another common thing that goes along with obesity and PCOS is a fatty liver. Now, we'll probably do a presentation just on fatty liver alone at some point in the future, but for just now, suffice it to say that if the weight actually starts to actually penetrate into the liver itself, then it actually can sometimes lead to the liver enzymes being not as good, for the liver not to be able to detox things as well. And also, some percentage of people will then go on to get cirrhosis of the liver, in other words, liver damage with time. And sometimes would also eventually, sometimes can potentially trigger things like liver cancer as well. Now, the amount of people with fatty liver versus these other sequelae and side effects does get smaller as the severity of these side effects goes on, but this is something that's a easily reversible thing that can be tackled through food and lifestyle choices. So also, sleep apnea is very common in women with PCOS as well, and again, that harkens back to the high rates of weight gain and obesity. So when there's extra weight, it tends to cause the throat to close up and more likely for these soft tissues to go. And so basically, the women and men who have obesity have a very, very high likelihood of having sleep apnea. In fact, I think it's about 20-ish% of people with a BMI that's over 30, which is technically the medical term for when someone falls in the obesity category. About that percentage of people have obstructive sleep apnea, and that percentage does go higher with a higher BMI or higher weights as well. Depression and anxiety, those are also very common in women with PCOS, and a lot of the medications that are used to treat depression and anxiety also, unfortunately, the main side effect of a lot of these medications does happen to be weight gain. And so that can be a little bit of a vicious cycle as well. And another reason why using diet and lifestyle factors in order to help treat the symptoms as well as the side effects of this particular disease, why that can be very, very helpful. And finally, as I mentioned first in the presentation, you can do different things to treat the infertility. And the infertility with the PCOS basically happens because with all these hormones being shifted, the women that have this condition do not ovulate as often as they would otherwise. So in other words, instead of an ovary popping out an egg once a month, and then the next month the next ovary pops an egg on the other side, it might be it pops one out on one side, and then maybe 2 months, 3 months, 4 months can go by before the other one submits an egg as well. And so this leads to some very irregular cycles, as well as women being rendered infertile by this. So that's another thing that you might want to keep in mind is when this condition becomes treated, whether it's through diet, exercise, metformin, or other medications, then sometimes this unpredictable egg release on one side and the other that happens with the PCOS, sometimes that can make women very much more fertile very quickly. And so I've actually known one or two ladies that as their weight started to come down, and it really only takes about 5 to 10% of the body weight loss in order to start to reverse some of these symptoms as well. And then all of a sudden they became fertile. And if you've been infertile for 5, 6, 10 years, and then all of a sudden your body catches up with you and the fertility comes back, well, it was a little bit of a surprise for some of these ladies with their pregnancies. They're very happy with it. However, it's something to keep in mind that as you start to use food and lifestyle as well as other means to control this syndrome, make sure that you're practicing safe sex, or I guess if you're trying to get fertile, you're not practicing safe sex. Sorry, I'll brain fart this afternoon. But basically make sure that you're prepared for the event of a pregnancy if the syndromes becomes well controlled. So, all right, so more specific things that have been studied more recently, and this includes more specific foods that are very good at helping with the symptoms of the PCOS. So particularly mint tea is one of the ones that I've been telling people about for the longest time. That is something that helps to reduce the amount of androgens or testosterone. In other words, those male hormones will go down with only 2 cups of mint tea. In the studies, they had a couple studies on both spearmint and peppermint, so it doesn't really matter which kind of mint. Just take some mint leaves, soak them in water, or use a mint tea bag, or grind up some mint and eat it in a pesto or something. But basically, 2 cups of mint tea a day lowered the testosterone levels by about 30%, and that can give some symptom relief over time. Next, there was another study that was done recently, and you can check it out on my favorite website, nutritionfacts.org. Dr. Greger reviews some research about marjoram tea. So the results didn't seem to be quite as dramatic with that, but it did seem to help the profile a little bit. So that was 2 cups of the marjoram as well. And marjoram is, again, something you can find in your spice aisle very easily. Finally, there's a lot of information about the effect of AGEs. What on earth is an AGE and where do you find it? So AGEs are otherwise known as advanced glycosylation end products, or glycotoxins. And the short version is these are chemicals that are released in your food and sometimes are present in the food even before they are cooked. And what these do is they are very, very inflammatory to the body. They cause symptoms of aging and basically tend to be very damaging to the body. Below, I'll post an article that shows some of the information about where you can find these and in the diet, and which foods would have higher and lower concentrations. For example, butter is very, very high in AGEs, and that might be why, if you check out my lupus presentation, I was able to find that the butter triggered inflammatory symptoms pretty readily as well. So basically, these AGEs, they're actually receptors for these things in our body, and their body naturally makes them, and the other main source is that we get it from our food. And women that have the PCOS, in their bloodstream, they seem to have about twice the normal amount of AGEs circulating. And these AGEs tend to build up in the ovary where it has these receptors. And we do not know if this is exactly the cause of the PCOS or just a contributing factor, but there seems to be a correlation between the two. And there's been some studies that show that women that have foods that soak up the extra AGEs, and Dr. Greger recommends or reviews brown rice and mushrooms as being 2 foods that grab hold of those AGEs and pull them out of the system. Also, foods that are very high in antioxidants can help fight some of that inflammation or oxidant properties of the AGEs as well. So high antioxidant foods, I mentioned the marjoram a moment ago, but basically any herb and spice generally is going to be very, very high in antioxidants. Brightly colored fruits and vegetables, especially berries, dark green leafy vegetables, all of those are very high in antioxidants. Green tea and other plant foods tend to be very high in antioxidants as well. And then just as important as having foods that can grab hold of and pull those AGEs out of the system is also avoiding them in the first place. So generally speaking, foods of animal origin tend to be much, much higher in AGEs than plant foods. So the highest level of AGEs are found in high temperature, high cooking temperature foods. So in other words, broiled, grilled, or fried foods that are of animal origin tend to be the highest in these AGEs. And the foods that are, yes, I'm just double checking my notes here. So basically, in order to improve your AGE profile, you want to avoid things like smoking, because that also increases the AGEs as well. So again, staying away from cigarettes and tobacco products of any sort, and also lowering the amount of broiled, seared, or fried foods. So pretty much anything that is broiled, seared, or fried is going to have more AGEs than foods that are steamed, stewed, or boiled, or potentially eaten raw. And so generally speaking, again, the higher the diet is in percentage of plant foods in general, the lower the amount of these AGEs is going to be, and also the more effective that diet is going to be at clearing out the hormones and also improving the symptoms of PCOS. Alrighty. So I hope you enjoyed this presentation. We'll have more later, and I'm sure if you check out nutritionfacts.org, Dr. Greger has been presenting a lot on this topic very recently, and so there's a chance there might be some more presentations coming up in the near future as well. All right, have a great evening, and we'll talk to you later. Bye-bye.